Hello, everyone, and welcome back to Shock Doc Medical. I'm Dr. Rod, and today we're diving into a fascinating topic that perfectly illustrates how our conversations about medicine can be as nuanced and rich as the human experience itself. Now, imagine this, a seemingly minor nosebleed, epistaxis, that might be more than just a random inconvenience. Could it be hinting at something deeper, like high blood pressure? That's exactly what we're exploring today in our discussion of an article titled Epistaxis and Hypertension, Reviewing a Complex Relationship by Paolo Spriano, published on August 8, 2023. You know, one of the things that makes human conversation so distinctly human isn't just the exchange of facts. It's our ability to weave in our emotions, our shared experiences, and even our little everyday quirks into the mix. Whether you're laughing at a relatable story or feeling that pang of empathy when someone shares a health scare, it's these layers that make our dialogue truly special. Let's talk about epistaxis, nosebleeds. Did you know that about 60% of people will experience a nosebleed at least once in their lifetime? Most of these episodes are mild, but for roughly 6% of folks, it can be serious enough to require medical attention. And here's where it gets interesting. Among the many culprits behind nosebleeds, dry air, allergies, even trauma, hypertension, or high blood pressure has been flagged as one of the key risk factors. The article discusses how, in clinical practice, many of us have observed that patients with hypertension tend to have higher blood pressure readings when they experience a nosebleed. In fact, out of 9 studies reviewed, 6 found that patients had notably higher arterial pressure during an epistaxis episode compared to a control group. Even more intriguing is the observation that in some cases, a nosebleed was the very event that led to the initial diagnosis of hypertension. Now here's where our conversation gets even richer, because as humans, we don't just exchange statistics, we share our experiences. I remember the first time I had a significant nosebleed. It was terrifying, and it made me wonder if it was just a one-off event or a sign of something more serious. And isn't that what many patients feel? A mix of anxiety, curiosity, and even a little skepticism when faced with these symptoms. The article further explores the severity of these episodes. In one retrospective study, patients admitted for severe spontaneous nosebleeds were analyzed. And interestingly, there were no significant differences in age, sex, or even the history of hypertension between those with severe and life-threatening events. Yet, what did stand out was that many older adults, with about half of them having a history of hypertension, experienced these severe episodes. Moreover, in roughly 43% of cases, a serious nosebleed was the first sign of underlying, previously undiagnosed high blood pressure. And here's another layer. When we look at large-scale studies involving more than 35,000 hypertensive individuals, the data suggested that those with high blood pressure not only had a higher incidence of nosebleeds, but were also more likely to end up in the emergency department. They often required more intensive treatments, like posterior nasal packing. It's a complex relationship that leaves us with more questions than answers. So, what can we take away from all this? First, it's a reminder that our bodies communicate with us in subtle ways, sometimes through a simple nosebleed, and that these signals deserve our attention. Second, it underscores the importance of looking at the full picture. The numbers, yes, but also the human experiences behind those numbers. Our discussions here at Shock Doc Medical aren't just about reciting statistics. They're about connecting on a human level, sharing our concerns, our empathy, and our relentless curiosity to understand how to better care for one another. In every conversation, there's that emotional nuance, the unspoken cues in our tone, and the shared context of our lives that transforms a clinical debate into a truly human dialogue. Whether we're discussing how to take a proper blood pressure measurement or the anxiety that comes with unexpected health news, it's this blend of science and humanity that makes our interactions so meaningful. I hope today's discussion gives you a fresh perspective on how even something as common as a nosebleed can be a window into deeper health issues, and why it's so important for us to listen to both our bodies and each other. Thanks for tuning in to Shock Doc Medical. If you enjoyed this episode, please hit that subscribe button, share it with your friends, and let's keep this conversation going. Until next time, I'm Dr. Rod. Stay curious, stay compassionate, and take care of yourselves.